A ketogenic diet can push LDL cholesterol, the so-called bad cholesterol, to levels most doctors rarely see. In some lean, healthy people, it reaches 250 or even 300. So what actually happens to their arteries? A new study set out to look. The people in this study are unusual. Most who cut carbohydrates do not see a big, lasting rise in LDL, but a specific subgroup does, and they tend to be lean, fit, and metabolically healthy. On keto, they develop a distinctive pattern: very high LDL, but alongside high good cholesterol and low triglycerides. Researchers call them lean mass hyper-responders. Here the study meets one of the firmest facts in cardiology. Decades of evidence show that LDL and its particles help cause the buildup of plaque in arteries, and that lowering LDL lowers heart attack risk. But these lean people are a mismatch, high LDL sitting next to markers that usually signal low risk. So it's fair to ask, and to measure directly, what really happens to their arteries. The study followed 100 people with this high LDL pattern who had been on a ketogenic diet for about 4.5 years. Their average LDL was 242. Researchers scanned their hearts with detailed CT twice, a year apart, and measured the plaque 2 independent ways to be sure. At the start, something notable. Despite their alarming cholesterol, most of these people had very little plaque. 57% had a calcium score of 0. No detectable calcified plaque at all, and more than 8 in 10 scored low. Alarming numbers on paper, largely quiet arteries on the scan. A year later, the plaque had grown, but only modestly. The typical rise in soft plaque was about 5.5 cubic millimeters. That reads as a big 37%, but only because the starting amount was so small that any change looks large in percentage terms. Most people stayed below the thresholds cardiologists treat as high risk. And here is the surprise. Some people moved the other way entirely. 15% showed their plaque actually shrinking over the year. Real regression, despite an LDL held above 240. A handful showed it on both measurement methods at once, which the authors take as a genuine signal, not just noise. Then the central result. When the researchers asked what predicted whose plaque would advance, the answer was not the LDL and not the ApoB. It was how much plaque a person already had at the start. In this group, a picture of the arteries carried the risk information. The cholesterol numbers did not. But read this honestly. It is a preprint, not yet peer-reviewed. There was no control group. It ran only 1 year, and it measured plaque on scans, not heart attacks. The authors advocate this model, and their foundation funded the work. It does not prove high LDL is safe, and it does not overturn the evidence that LDL drives heart disease. So, if your LDL has climbed on a low-carb diet, the honest takeaway is not that it's safe, and not that it doesn't matter. It's that your arteries deserve an individual conversation with your doctor, informed by a scan, not by a single number. New Age Medica. Research, translated for everyone.